Hello, it's Angus Perry, founder of GP.AI. Today I'm going to do a brief demo of how to generate a management plan. So you choose the management plan and then you select which plan you want to do. So I'll choose the dementia prevention plan. You can send a pre-assessment email to the patient which prompts them about the information that the assessment will entail, so they can come pre-ready with the information. Once you've done that, and once the patient is in front of you and you're sitting with the patient, you then go through the risk factors or the habits for the particular plan that you're creating. So I'll just click through these. So 10 is when the particular habit or risk factor is optimized, and then 0 to 1, 2, or a low score is when the risk factor is not optimized. So I'll choose low for alcohol and blood pressure, and perhaps glycemic control as well. And then I'll just click through the rest of them. And then we'll close that. So then we can add some information about the assessment. So we assess how confident the patient is about managing their health and also how much agency or influence they have on their day-to-day. So this is a score between 0 and 10, and these answers will influence the nature of the check-in questions that you generate for the patient. So I'll say they're high confidence and high agency. We'll close that down. And then we can add other resources. So for example, I might want to add some information about diet, about exercise. Perhaps I want to add some smoking cessation information as well. Close that down. And if you want to, we can add some research. We then press suggest goals, and it will look at all the information. It will look at the risk factors, the ones that they've scored poorly on, and it will help you to actually decide on the goals for the patient. So it found out that the alcohol consumption was high and the blood pressure needed better controlling, and there was some issues with the diet. So then we select a follow-up date, and then we press this button here. And then it's going to put together the management plan. And this takes about 20-30 seconds or so to happen. Okay, we've got our plan. So we've got our goals, risk factors. We can see all the habits and the scores here. This is not what the patient will see. They'll see a much more summarized version on their phone. We just need to check that we're happy with the content. Then we generate more information about the goal. So we've got 3 goals, and we're going to add some more information to the goal. We're going to put some meat to it. We're also going to generate the check-in questions as well. So what we can do is if there's anything specific we want to add to the check-in questions, like what specific things we want the patient to check in on a daily basis, we press this button here and we can speak to the app, and it will just record what we've said, and that will update the check-in questions. But what it's done is it's got the goals that we've asked for. It's put a bit more information onto the goals. So behavior, capability, opportunity, motivation, so COM-B. And it's also created the check-in questions. These are based on the risk factor scores, based on what needs to be improving. And these are the daily things that the patient will be assessing. And once we're happy with those, then we just press this button here, press to confirm and close. And that's it. We can generate an audio summary, a referral letter, or an electronic health record note. And then all we do is just export it to the patient. So I'll just put my email address here. And it's important that the email address you use is the same email address that is registered with the patient. We press submit, and we're done.